Could you first introduce yourself and tell us a few words about your work?
Hi, I'm HOUMAN FARZIN and palliative care physician in Montreal, Canada. I do palliative care at the Jewish General Hospital, and I'm doing psilocybin-assisted therapy for end-of-life distress. I'm also part of the MAPS research team and hope to do that work once MDMA is available.
What's the potential of psychedelics in treating end-of-life distress?
I think it has a very strong chance of becoming the standard of care. So far, our limited experience having treated the first patients legally in Quebec has been very positive. There is a similarity between the psychedelic state, the altered state of mind, and end of life. And people, for example, that have had near-death experiences also allude to that. And so I think for this particular indication, it's really very promising.
What are your concrete experiences with patients you treated with end-of-life distress?
Yeah, the experiences have been remarkable. The reality is no two experiences are similar, whether it's for the same individual or for different individuals. And so we're always learning, adapting, and growing. But fortunately, all the experiences have been positive. So, when I specifically ask my patients if they could go back in time, would they repeat the experience? They would say yes. And in fact, many of them want to have second sessions, and so we're in the process of planning second sessions for them.
What are the problems people face when the end of their lives approaches, and how psychedelics can help to overcome those problems?
Yeah, that's a good question. There's a sense of demoralization that happens, and it's really a blend of depression and anxiety symptoms. But it's a bit different from typical depression, and it has to do with the fact that people, as they approach the end of life, become like a newborn, and they have to rely on others for their basic needs. And many people have a hard time going through that transition. And the other aspect is the aspect of leaving behind everything that they've experienced as their norm for the entire life. And by psychedelic medicine, and creating a mystical experience, we're able to give them a sense of unity with being and a sense of continuity and timelessness, which seems to be really helpful.
How do different psychedelic substances compare in their potential of healing end-of-life distress?
That's a good question. Specifically related to end-of-life distress, psilocybin is the most widely studied at this stage. LSD is generally very similar to psilocybin. It just has a longer duration of effect. And there are limited studies on ketamine and MDMA that are somewhat positive. They're just not as definitive, and the study quality hasn't been as good. But that's about to change, and hopefully we have a bunch underway.
What are the legal and political barriers in Canada, and how did you overcome those barriers?
Canada actually is leading the world now because they've officially added psilocybin and MDMA to a program where a physician or other prescriber can apply on a case-by-case basis, and using a correct argument and providing the right amount of research, the government, Health Canada specifically, grants permission on a case-by-case basis. So a lot of the legal barriers are now easier. That being said, it's still difficult. It's a time-consuming process, and we're putting together systems to help patients in this regard. But the beauty of the work, at least in Quebec, has been that the government has paid, and we're in the process of getting official agreement from them to pay and cover this under the public system. So I think one of the biggest barriers is really just misinformation and the stigma that exists in society, and not only within people, but also healthcare providers, and just not knowing about what's been going on and what the evidence is showing.
What struck me in your presentation today was that in some patients, psychedelic therapy does not end suffering, but it helps people to find a meaning. Can you talk about that a bit more?
Yeah, it's very interesting, because, that particular session, we're dealing with an individual who has a lot of physical pain, an individual with a tube in his chest and trouble breathing and missing a nose and really suffering to a very high degree. And what was interesting about that session was that during the session, once he broke into the psychedelic state about an hour and a half into the session, he learned how to separate himself from the pain. And so in a sense, during the session, he did not suffer from his pain. But we weren't able to maintain that after the session because the level of suffering was very significant. And so despite the fact that he was still suffering and having a hard time separating himself from the pain, the experience he had with the psilocybin, which he described as profoundly mystical, the most mystical experience of his life, gave him that sense of continuity. And as his organs are failing, as his life ends, and as he plans on getting medical assistance and dying next week, he is gradually going into that mystical state more and more naturally as the result of the process of death.
When we speak about mystical experiences, what people describe as those?
I mean, what's interesting about the mystical experience is the ineffability, which is essentially the lack of ability to describe the experience with words. But it's just, how we can gauge it is by how important and impactful it is on the patient's life. When it gets regarded as a top 5 experience of their life, next to having a child or marriage, that just shows how incredibly powerful it is. And the way people describe it varies, and words can't do it justice.
What kind of training professionals need if they want to assist in psychedelic treatments?
So when dealing with mental health related issues, they need to have a basic training in mental health. And currently we set a standard of a master's degree education with a minimum of 5 years experience working in the field of mental health. That being said, you have to also be registered with a professional body that is focused on mental health. And then there's the psychedelic component of it. And what's interesting about the psychedelic component is that it's different in many ways from a standard mental health training. For example, when we do training for therapists, we emphasize the importance of humility and learning to control one's ego and learning to explore one's dark side and things of that nature, which aren't really done typically. I mean, in the past, a lot of psychoanalysis programs required deep psychoanalysis, but in general, there's been a move away from that. And so we require, from our perspective, experiential training directly with the substance, including other training.
You mentioned in your presentation that what's really difficult is this first breakthrough to the psychedelic experience. Can you talk about that?
Yeah, it's very interesting, and it goes back to this concept of internal family systems, and Dick Schwartz, who essentially, came up with that based on his patients' experiences. And, what it talks about is us having this true self that everyone has in common. It's this beautiful entity that's curious and compassionate and all these beautiful qualities, and that throughout life, the adverse experiences and traumas we have basically force us to make these parts that play usually protective roles or managerial roles. And a lot of times these parts, they just grow out of proportion and take over our personality. And so, the goal with the psychedelic therapy from that approach is to connect to our deep inner healing intelligence, our true self. And so, in that scene, we see how as soon as I talk about this being a part of him, it's not him, and it served a function that really broke through all the defenses. The smile came, and he was willing to do the deep dive.
Thank you very much.
It was a pleasure.
Is there anything I didn't ask and you want to add?
I just want to give thanks to everyone who's done the work for us to be able to now execute it, and especially to the Indigenous people that, in Canada especially, they've been colonized in a very harsh way, and we're still seeing the issues related to that. And I really hope that we can respect them, and then also have them kind of have access to these forms of therapies if it's something that they're interested in.